A lot of plastic surgeons have lasers available to them in their office, but each laser is going to do something different. So in my office, I have the Sciton Joule X platform, which I think is the top of the line in terms of lasers out there. So you come to me, you're probably in your 40s to 70s, and you have deep wrinkles on your face, and you're like, "Doc, how do I get rid of these deep wrinkles?" That's where that ablative resurfacing comes in. Next, I have the Profractional, which is a fractionated erbium laser. It works very similar to the ablative laser that I just talked about, but instead of being a full field laser, so I'm not taking the complete surface of the skin off, but I'm punching individual holes across the skin. So if you have something like acne scarring and you have uneven texture, when the skin grows back, it's going to create a more smooth or confluent appearance to the skin. It's also a great laser to use on surgical scars to flatten them out and do basically the same thing. You have one raised scar and you want to flatten it out. That's what that fractionated erbium laser is going to be great for. After that, I have the halo laser, which is kind of a great kind of stepping stone toward that ablative erbium full field resurfacing, but with much less downtime. It's using two wavelengths. One is going to cause some deeper areas of skin necrosis that stimulate new collagen and cause some skin tightening or a new collagen formation. So it's creating a more robust layer of skin and improving the skin quality. And then superficially, it has that fractionated erbium component to it. Lastly is the BBL or broadband light laser. In my practice, primarily, I'm using the BBL to treat reds and brown skin tones in your skin. So if you have small blood vessels on your skin, or you have some brown spots or freckles or any sort of dyspigmentation, you want to kind of even out the skin tone better across your whole face, the BBL is a great laser to do that. It also has some of the best data behind it. There's a dermatologist at Stanford, Patrick Bitter, that published a paper several years ago showing that with 3 BBL treatments 4 to 6 weeks apart, it actually changes the genetic expression in the skin. So you're starting to express more youthful genetics in your skin. That's something that you can start really early on, and it's kind of a maintenance laser to make sure that you don't have brown spots or red spots popping up on your skin. That's really the laser suite that I offer in my office, and I think it's great for the facial rejuvenation patient to treat every aspect of their facial aging and making sure we're talking about treating the skin on top of the surgical results that they're seeking.